Well, we are in the thick of the flu season in Connecticut, and this year it is quite bad.
Yeah, hospital emergency rooms have been overrun with people complaining of flu symptoms. So many of them. In fact, a lot of hospitals aren't even testing for the flu. They are just treating it. News 8's Bob Wilson live in Hartford with the latest on the spreading flu bug here. Bob?
Now, the flu is officially statewide, according to the state health department. And when you have the flu spreading like that, going through the different hospitals, there's to add on top of that a nasty stomach bug, and they've got doctors working overtime.
It gets into one household and then it spreads, and it really just, it knocks you to your knees, literally.
Dr. Jeff Finkelstein describes just how bad it can be. This year, it's not only the flu that's clogging ERs across the state.
We're seeing a lot of flu cases, influenza-like illness. We're also, at the same time, seeing a very nasty gastrointestinal bug, abrupt onset of nausea, vomiting, diarrhea, chills, and it's just going through families.
The hospital at Central Connecticut in New Britain saw nearly 275 patients in one day. At Hartford Hospital, they called for all hands on deck as they treated an all-time record high, 376 patients in one day in the ER. The flu and GI bug are to blame.
If you can take care of yourself with rest fluids, Tylenol, please do so. But if you really need our help, we're here for you.
Here at Hartford Hospital, the spike in the flu is so severe that the doctors and nurses, they don't even have time to come out and talk to the media. As a matter of fact, they're not even testing for the flu. If you have the flu-like symptoms, that means they're going to start treating it right away, especially if you're the elderly.
We're not testing in the ER unless you're a high-risk person, like someone who's immunosuppressed, transplant patient, elderly, very young, some diabetics.
The state health department says 3 people in Connecticut have died from flu complications, but they were all 45 years or older. Doctors say if you don't fall into the high-risk category, there isn't much they can do for you.
If you're a healthy person with a cough, chills, fever, we're just treating the symptoms and sending you home to bed.
Now, the flu, that's more the ache, the fever, and the cough. The GI bug is definitely diarrhea, vomiting. So if you have something with your stomach, that's a GI bug. Otherwise, it's the flu. And doctors say, wash your hands, wash your hands, wash your hands. That's your best defense against both. I'm Bob Wilson reporting live in Hartford, News 8.